Hello, I'm Dr. Randy Hansbrough. I've been in practice in Stuart, Florida since 1981, and I am what is known as a chiropractic neurologist or a functional neurologist. I received my certification from the world-renowned Carrick Institute for Graduate Studies, and I'm registered with the American Chiropractic Neurology Board. This is under the auspices of the National Commission for Certifying Agencies, which is the international gold standard for medical, nursing, dental, and chiropractic certifications. I say this because I have the ongoing training and recertification every year to help you get to the root of your fibromyalgia condition. Fibromyalgia is an autoimmune disease. It is influenced largely by how autoimmunity begins. And while it may seem like it's unrelated, they are very much related. And that is leaky gut syndrome. The scientific name for that is intestinal permeability. Basically what that means is your intestines are not properly filtering out the contents in your bowels. Normally, the pores in your intestines are very small. They are so small that only a very tiny, almost microscopic particle of food can fit through to go into the liver to be further metabolized. But when those pores become too large, large particles of food, large food proteins go into the liver, and that is an unnatural thing, so the immune system regards those food proteins as enemies, which it attacks with antibodies. That is the beginnings of autoimmunity in most instances. Of course, autoimmunity can be triggered by other things, as we discussed earlier, like a parasite or a bacterial infection or other things like that. But the most common one is food sensitivities. So if you have leaky gut because your intestines are inflamed and the pores are too large and large particles of food go into the liver, you will likely trigger autoimmunity, which will affect your liver. Your immune system will react. Antibodies attack, and they typically, because they're flowing all around your body, are going to attack all of the connective tissue. And that's because connective tissue is everywhere. Muscles, ligaments, tendons, joints. And when the antibodies get to a point where they are high enough in concentration, where they are overwhelming your connective tissues, you're going to get fibromyalgia. Or you could get fibromyalgia. You could end up with some other symptoms too. For example, some people are just naturally stronger genetically with all of their connective tissues, so the antibodies are not going to affect them. Instead, they will develop issues in the brain, and they'll have mood swings, insomnia, fatigue, digestion problems. Of course, that goes back to the leaky gut. They'll have dizziness and vertigo problems. They will have memory decline. But you know, most people who have fibromyalgia, they have all these things, or a couple of these things anyway. So almost every fibromyalgia patient that I've ever seen will also have issues with sleep, their moods. They'll be tired all the time. Their digestive processes don't work so well. Sometimes they get dizzy, not always, but many of them do. And their memory usually isn't so bad, if for no other reason that they're distracted constantly by the pain in their muscles and joints, tendons and ligaments. So their tendons and ligaments and muscles and joints are hurting all the time, and that's a big distraction. I hope that we've covered this relatively well, that in my opinion, based on all the research that's out there and the study that I've done, fibromyalgia is an autoimmune disease. Usually it starts in the gut, spreads to the liver, the immune system reacts, antibodies attack the connective tissue, you have pain, but also you can have issues with all of these things here. It is critical to understand that drugs will never cure you, and while they may be useful for temporary periods, we must make every effort to find out what the problem is, because if we don't, you will likely get worse over time while your doctor gives you more drugs to combat the side effects of the drugs you are now taking. I've helped many people with fibromyalgia, and there's also an excellent chance that I can do the same for you. I care about people, and I want to see you healthy again. So, in order to do this, we will have to run lab tests, looking at your blood, urine, and saliva to see what the problems are, and then correct them with potent nutritional products called nutraceuticals. Unlike pharmaceuticals, which are drugs, nutraceuticals work by rebuilding your health on a cellular level, which helps your body repair itself so it isn't under stress so much all the time. Now, according to abundant research worldwide, you stand a much better chance of succeeding with nutraceuticals compared to drugs. Once you experience this for yourself and you see the difference, you'll never want to go back to the old way of doing things with the drugs you've been taking. You'll realize that your symptoms were worse when you were taking pharmaceuticals for things like insomnia, fatigue, depression, loss of libido, bowel dysfunction, memory and concentration problems, joint pain, muscle aches, tingling and burning, and the list goes on and on and on. You probably wouldn't be watching this video if you were happy with the treatment that you've been getting. Now, I want you to know I really care about my patients, and if you become one of them, I will turn over every known stone until we find out why you are suffering. Now, another reason that this is often overlooked is the effect that the brain has on fibromyalgia. This is very important because when the brain is underperforming in various areas, it becomes fatigued. I know you must know what that feels like. It becomes more sensitive to pain signals from all around your body. That is why people are put on antidepressant medications, because they're trying to suppress the emotional aspect of living in constant pain. And that is also why you may be putting on weight, even if you exercise and eat small portions. The reason drugs can cause weight gain is because they disrupt brain chemistry and they decrease metabolic activity. This is why it is so important to have a fully functioning brain without the drugs interfering in the natural processes. Let's take a look at how this works. The way that the brain influences fibromyalgia has to do with its balance of the left hemisphere and the right hemisphere, and the left cerebellum and the right cerebellum. Now, in the left hemisphere, it's primarily involved in analytical types of responsibilities like logic, language, science, and math. The right hemisphere is primarily involved in creative pursuits like intuition, holism, music, and art. Ideally, we would have both sides of the brain balanced or as close to balance as possible, taking into account that each individual is dominant naturally on one side more than the other. We would also want to have the cerebellum structures as balanced as possible, because when they're balanced, they influence the hemispheres in a manner where they are more likely to be closer to balance as well. The point being, the more balanced the brain can be, the better functioning the brainstem will be, and the less sensitive the limbic system will be. When your limbic system is less sensitive, you will perceive fibromyalgia pain less intensely, which means we can work on the condition from an autoimmune standpoint more effectively and more comfortably for you, so that while we're balancing the brain, we're improving the autoimmunity along with it. Now, back to the midbrain for a minute. The midbrain controls all of our autonomic functions: heart rate, blood pressure, respiration, digestion, sleep, and temperature regulation, among other things. When the midbrain is happy, Generally speaking, the limbic system will also be happier and you will have less pain. In order to get that state the way we want it, we want a more balanced brain. We have ways of evaluating your brain in a very non-invasive fashion, and we look at your ability to balance and coordinate and see if one side is weaker than the other. And we also look at all your cranial nerves, assessing your ability to smell, see, the movement of your eyes, facial sense, facial expression, balance, swallowing, the assessment of your heart, lungs, and GI, neck movement, and tongue movement. And when we understand how your brain is doing and which side's weaker, we can initiate very gentle, friendly therapies to facilitate a stronger brain in wherever the areas are weaker. And when we are able to achieve that, ultimately your limbic system is happier and you perceive less pain. Now, let's talk about what we're going to do to approach your fibromyalgia condition. First, we will analyze your blood serum for antibodies against your muscles and joints and other parts of your body. But we will also look at antibodies against food proteins that may be complicating your overall health picture. Further, we will look at whether you have intestinal permeability, which is also known as leaky gut syndrome. That's the common term. And that will be revealed on a blood serum profile. These are very advanced tests. Now remember that wall chart we were showing with the limbic system in your brain? Well, if your brain chemistry is out of balance, it can affect your entire brain, including its perception of pain, which amplifies it. We will then analyze your urine and measure the neurotransmitters from your brain. Abnormal levels of brain chemistry can cause abnormalities in sleep, moods, energy, memory, focus, libido, and more. It is important to know we should also look at your hormone levels in your saliva. Hormone levels from your adrenal glands that are abnormal, as well as other adrenal functioning, can affect your entire body and brain, just like brain chemistry can. So we need to know all about that and be very thorough. Many times it's a combination of autoimmune antibodies, brain neurochemistry, and hormones, all adding up to a toxic cocktail that harms the brain, harms your body, and gives you a lot of pain. And we need to be diligent and do something about that. So once we gather all of the evidence from these three systems in your body, we can then put together a plan of action to begin the process of repairing you. Your action plan, which I control and guide you through, could look like this. 1, we repair the intestinal permeability or your leaky gut syndrome with potent but gentle nutraceutical medical foods that will heal the inflamed membrane and allow for a return to normal digestive function. 2, we want to remove all the offending and inflammatory foods from your diet, which we find out from blood testing, and replace them with healing anti-inflammatory foods. 3, we want to add in nutraceutical medical foods that calm the immune system, soothe the adrenal glands, balance the brain chemistry, and significantly reduce your inflammation. These are prescription products that are very strong and helpful. So as you participate in this team effort and this process goes forward, I'm certain that you will feel steady empowerment while your body heals, pain lessens, and your body recovers from general systemic breakdown. I want you to listen to what Paula says and also Gloria about their experiences and the improvement they have had with this natural approach.
Hi, my name is Paula, and I've been coming to Dr. Hansbrough's for about 6 months now. And when I came to him, I was in pretty bad shape. I had digestive problems, I had terrible dizziness, I had a lot of pain, I had sound issues, or sound was bothering me, and I was in pretty bad shape. Couldn't sleep at night, and I have to say that since I've started with all of the treatments he's given me, the neurosurgicals and the testing that we have done, we have been able to repair almost all of that now. I'm sleeping wonderfully. I have very little pain. We're almost through that, and I can honestly say that it has been a wonderful experience for me. And to top it off, I lost weight, which I wasn't even expecting to do. So if you're having any of these issues, please do not hesitate to come in and have a conversation. And I can almost guarantee you that Dr. Hansbrough can help you.
Hi, I'm Gloria. I made my last video for Dr. Randy Hansbrough about 3 weeks ago, and I was starting to feel a little better then, but I'm now feeling really good. I mean, I have the energy when I get up in the morning, and it's just good to be up and around and feeling good again. I went to my regular doctor last week, and my blood work and everything was so improved. I had lost weight. My blood work was perfect. She took me off some of my medications. I'm off about 4 of my medications now, and hoping to get rid of more. And mostly all I can say, it just feels so great. Without Dr. Hansbrough, I would not be able to say all these things. It's good to be alive again. I feel more like the me I used to be.
These are just 2 examples of many patients of mine who have taken charge of their lives with my guidance and gotten rid of their fibromyalgia conditions. And it's what you can experience too when we work together to get to the root cause of the problem. You should know that the longer you wait to do something about it, the worse this will get and the more challenging it will be. Now, many have told me that I was their last attempt to gain control of the normalcy they once had before they were taking all their medications. They remember the days of a good night's sleep, plenty of energy, a clear mind, normal weight, no aches and pains, and a lot of other pleasantries of a healthy life. Well, you can have that too. All you have to do is call me. We'll set up an appointment for a consultation. Remember, you have 2 free visits. Let me and my friendly, caring staff, Jody and Marion, get your life going again. I really look forward to meeting you soon. Thank you.